Hi, I'm Rick Kaler. Thanks for joining me. The opening date, October 1. By then, the competition will be lined up and ready to go after bronze, silver, gold, and even platinum. These competitors, though, they're not athletes. They're insurance providers. The field they are entering is the new healthcare exchanges mandated by Obamacare. Beginning January 1st, 2014, nearly everyone in the U.S. will need to have health insurance or pay a tax penalty. Those not insured through their employers can apply for coverage through these health insurance exchanges, also called marketplaces, and the enrollment begins October 1st. These exchanges are intended to make it easier to find insurance providers and compare their coverages and costs. Each state's exchange website will list all the policies available in that state with prices and policy provisions. Now, South Dakota so far is one of the 50% of states that have opted to use exchanges managed by the federal government instead of setting up their own. Bronze, silver, gold, and platinum describe the four basic categories of policies that will be available through the exchanges at different costs. Now, here's a really brief summary of each category. The least expensive option is the bronze plan. This might be the best choice for younger people with lower incomes and good health. The plan will pay 60% of health costs, and the insured will be responsible for 40%. The next level, which is silver, will pay 70% of healthcare costs. Gold covers 80%, and platinum, as you can imagine, covers 90%. Obviously, the categories with the higher benefits will have the higher premiums. All these plans are required to cover essential health benefits, and these include preventative and wellness care like cancer screening, chronic disease management, pediatric care, many prescription drugs, injury rehabilitation, mental health, addiction treatment, maternity, newborn, hospitalization, and other emergency services. Companies are not allowed to deny coverage or charge more for those with pre-existing conditions. This is a big change from the past, and also there are no lifetime benefit limits. The requirement to have a health insurance coverage, which is the stick of Obamacare, is accompanied by a carrot in the form of federal subsidies to help pay for those insurance premiums. Now, they estimate that about 2/3 of Americans will be eligible for subsidies, which will be figured on a sliding scale. The upper limit for qualifying is 4 times the federal poverty level, which amounts to $88,000 a year for a family of 4. I've seen other publications that say it's about $95,000, $96,000. Now, this summary that I've just given you is just the barest outline of the healthcare changes coming our way. To find out more, it's a pretty good idea to spend some time online, especially at 2 sites that offer a lot of helpful information. The first is the federal government website at healthcare.gov, and that will provide links to the state exchanges, plus a lot of detailed information that, for the most part, is really explained in pretty straightforward, plain English. The second site is the Henry K. Kaiser Family Foundation. It's at kff.org. Now, what I found here was an especially useful tool available, which is their interactive subsidy calendar. And this is a calculator. It's a calculator that's determined, they will help you determine the federal subsidy that applies at your family's income level. So take a look at that. So the elements of Obamacare that will take effect in 2014 represent a pretty big shift in the way we cover health care costs. I really recommend that you start now to figure out what this is going to mean for you and your family. The more informed you are, the better insurance choices that you're going to be able to make. The changeover to the new insurance environment is likely to be chaotic and confusing. I think that's one reason why they've already put the employer mandate out a whole year. So navigating all this is going to take some energy. It's going to take commitment. It's going to take stamina. When all the scrambling is over, we can only hope that the ultimate winners are going to be the American people. We'll have to wait and see. Thanks for joining me.